In this video, we discuss the use of cimetidine during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Cimetidine is available at the grocery store. At least in the US, in much of Europe, it still requires a prescription. Cimetidine, sold under the brand name Tagamet, inhibits the action of H2 histamine receptors. Histamine is strongly implicated in tumor growth. Anti-cancer effects of cimetidine include reducing metastasis by blocking the attachment of cancer cells to blood vessel walls, reducing Treg cells, which put the brakes on the immune system, and improving the immune system by stimulating dendritic cell activity. Not only is cimetidine safe enough to be an over-the-counter medication, it has ample clinical data. One study compared stage 3 colon cancer patients who had their cancer resected and received chemotherapy. One group also received a daily dose of 750 milligrams of cimetidine, while the control group did not. Overall survival in the cimetidine group was 3 years compared to 9.5 months in the control group. Length of treatment with cimetidine was also associated with overall survival. In another placebo-controlled colorectal cancer, the group taking 800 milligrams of cimetidine daily had a 10-year survival rate of 84.6%, while that of the control group was 49.8%. Additionally, meta-analysis of 421 patients who had surgery for colorectal cancer revealed cimetidine conferred a survival advantage. A 1992 trial revealed that 2 patients out of 42 with advanced refractory kidney cancer had a complete response to cimetidine as a monotherapy. That may not seem like an encouraging number, but it was in refractory patients as a monotherapy. In a 1982 report, 6 melanoma patients, 5 of whom had disseminated disease, had been treated with interferon alpha with little evidence of effect. Cimetidine was then added and produced a complete response in 2 patients, a partial response in 1, and disease stabilization in another. The same authors then performed essentially the same experiment with 20 refractory melanoma patients and obtained 5 complete responses, 1 partial response, and 3 cases out of stable disease. Other studies with melanoma have shown more of a muted effect than these first 2, leading some to speculate that the form of interferon used may have played a role. The type of interferon used in the above 2 studies, human leukocyte-derived interferon, has a wider range of interferons in it than the type used in following studies, recombinant interferon 2-alpha. In glioblastoma, cimetidine, as part of a 5-drug cocktail, extended survival to 11.2 months after first recurrence, compared to 4.3 months in the historical control. Cimetidine also increases the amounts of tumor-infiltrating lymphocytes, TILs, found in tumors. As TIL treatment steps closer to FDA approval, this will become increasingly important. In TIL treatment, instead of simply discarding a resected tumor, the tumor-infiltrating lymphocytes in it will be harvested, replicated, and re-injected into the patient. It is already showing response rates north of 70% in refractory cancers. Cimetidine interacts with many medications, generally increasing their blood concentration. This is frequently, but not necessarily, a good thing. It is important to check for interactions of cimetidine with any medications you are taking. For more information, please see the book Cancer Self-Defense 101 Quick Tips to Help You Survive.